Today we will get the first exposure of a practical, that is our staining method, commonly known as the Gram staining method. Okay. So let us look at this question. So in an hospital, the ICU reports an outbreak of Clostridium difficile infections. Now Clostridium difficile is a gram positive bacteria which is commonly associated with the hospital acquired infection, and it causes diarrhea associated disease. Okay. Now this kind of infections are going on in an ICU. The investigation done by the team shows that the quaternary ammonium compound that was used to clean the ICU is not effective, especially for C. difficile spores. Now what is a spore? I think you have some idea. What is a spore? No, it's not reproductive. What is a spore? Hmm? Good. So basically spore is that form of a bacteria when the bacteria is exposed to unfavorable condition. It could be any unfavorable condition. It could be extremes of temperature, nutrient deficiency, anything. So it forms what is known as spore to protect it from the environmental elements. And when the environmental elements comes into its own terms, that is, it can propagate and survive and propagate, the spore germinates into viable bacteria. Okay. Now what is the problem with this spore? Why we are so much concerned about these spores? Any idea? Exactly. So whatever methodologies we used to get rid of a bacteria might not be effective in case of spores. This is the reason why you need to learn about the sterilization process. So in this context, we have few questions. What disinfectant should be useful in this case of spores? We need to know, right? If all are not effective, we need to know what are effective. Then how can we use appropriately? And furthermore, what would be the cleaning protocols in case of an outbreak? Normally outbreak doesn't happen, but we should also know what to do if an outbreak happens. Now for that we need to know about sterilization. Now you have to contribute. This is not a lecture class, this is a discussion class. So what is sterilization? Now when we say sterilize, what do you mean commonly? Sterilize, if I say we need to sterilize a particular thing or an object, what do you mean? That means there are no organisms, right? If we look at the proper definition, it would mean the process by which all living microorganisms, including spores, when it is get rid of, it may be a surface, it could be a material, then we call it as sterilization. More precisely, mathematically speaking, we need to remember two things. First is a reduction of 10 to the power 6 logarithmic CFU. What is CFU? Colony forming unit, right? And what is the logarithmic reduction? What is logarithmic scale? This is basic mathematics. So that means by at least 10 to the power 6, that means 10 6 log scales, the number of bacteria should reduce. So effectively, if there is 10 to the power 6 organisms after the process, none of the bacteria should live. Right? Now, we need to know what are the process by which we can achieve this. So there are two types of method. One is a physical method, another is a chemical method. Physical method means by which we can change the physical elements. Now please remember, the bacteria or microorganisms have to endure environmental conditions. The environmental conditions could be physical elements, could be chemical elements. Hence, the agent could be physicals or chemical. The physical methods could be, first is steam sterilizer. It has the word steam. What is steam? It's a water vapor at a temperature of 100 degrees centigrade. The next come is dry heat. When we say dry heat, that means there is no water or steam, is only heating. The third would be filtration. So, filtration can be done on two mediums only, that is a liquid and gaseous medium. You cannot filter a solid object, right? So, filtration will be useful only in case of liquids and gases. Then we have radiation. Radiation could be ionizing radiation, could be non-ionizing radiation, and other methods of heating. One could be incineration. Incineration means to burn. Another is microwave heating, heating with the use of microwaves. So, all these are physical elements. Now, if you look at the chemical methods, there are two methods. First is ethylene oxide. Ethylene oxide is a chemical. I will come to it later. And finally is a plasma sterilizer. Now, when I say plasma sterilizer, please don't get confused with plasma of the human blood. Over here, plasma means it is the fourth state of matter: solid, liquid, gas, and plasma. Now, having understood this sterilization, then what is disinfection? You have understood sterilization. Then what is disinfection? Now, I am asking you, what do you understand the word by disinfection? To render something non-infectious. Disinfection. Like disease. Ease means you are at ease. If you are not at ease, that means it's disease. So, disinfection means the process which destroys or removes most but not all pathogenic organisms. It may or may not destroy bacterial spores. If it does that, then we will call it as a process of sterilization. Again comes the mathematics. If we achieve at least 10 to the power 3 logarithmic reduction on the colony forming units, we will call it as disinfection. But more importantly, disinfection has no activity on spores. Have you understood till now? Now let us look back at the question that I first stated. The C. difficile infection spreads through spores. So, will disinfection be effective? No. Right. Again, like sterilization, it could be achieved by physical or chemical methods. Furthermore, it is used only on inanimate objects and not on living bodies. I will come to it later. Just keep it in mind, it is not used on living body. So, types of disinfection has been further divided into three types: high level disinfection, intermediate level disinfection, and low level disinfection. So, what is high level disinfection? When, if used in a sufficient concentration, it will achieve sufficient killing, and it will kill all types of microorganisms. This is called as high level disinfection. Then intermediate would be, it will kill all microorganisms but not on spores. Low level disinfection means it will disinfect or kill most of the organisms, but some will be resistant. Most notably, it will be tubercle bacilli and spores. Why tubercle bacilli is important? Because India is an endemic country for tuberculosis, most importantly pulmonary tuberculosis. So, when we do have a patient who is suffering from pulmonary tuberculosis, he or she will cough, and every time he or she coughs out, she will be spitting out the bacilli itself. So what do we suggest him? To spit at a particular in a particular container containing some sort of disinfectant so that the bacilli can be killed, right? What sort of disinfectant? Can we use low level disinfectant in that case? No, we need to use intermediate level of disinfectant. Now you have understood the concept behind all these things. Everything has a practical importance. Okay. Now coming back to the original question. So in case of that ICU problem, we cannot use intermediate or low level disinfectants. We need to use high level disinfectants. Now let us look at the types of disinfectants. You don't need to remember it. You read. The more you read, you will get more acquainted with them. Then you don't need to remember all this. Let us look at the high level disinfections. Obviously, no physical methods are there, because if the physical methods are, it will become sterilizing methods. So over here the chemical methods will be aldehydes like glutaraldehyde or orthophthaldehyde, paracetic acid and hydrogen peroxide. Very commonly you will find the use of glutaraldehyde in the hospital premises. Coming to the intermediate level, we have many physical methods like pasteurization, boiling, steaming. These are used in various industrial aspects but not very commonly used in the hospital. Nevertheless, boiling and steaming are still used. More importantly, the alcohols that are used. If you do remember, during the pandemic, the use of alcohol was promoted. The various types of alcohol, from isopropyl alcohol to absolute alcohol, these are used. Then phenolics. Phenolics means agents containing phenols. Those are used to clean surfaces. It could be floor, walls, etc. They all comprise the intermediate level of disinfection. Another important intermediate level of disinfection is use of ultraviolet radiation. Finally, in low level disinfectants, we have two types of compounds. One is a quaternary ammonium compounds, and the second is chlorhexidine. You have heard about chlorhexidine? It is very commonly used in the mouthwashes. It is also used before giving any injections. So these are low level disinfectants. Now, another type of disinfectant is antiseptics. Please remember, when I was telling you about disinfectant, we cannot use it on living body. It is used only on inanimate. That means non-living. So when we do have to use on human skin, can we use disinfectants? Can we use phenols? No. So we need something which can disinfect the skin but should do no damage to skin also. Otherwise there is no point of doing it. Now will it achieve that level of disinfection? No. So antisepsis means the process by which we use some chemicals. First of all, it will not harm the human body, skin or anything else. Secondly, it will try to prevent infections by rendering the pathogenic organisms non-infectious. However, its ability is very limited. What would be the examples of them? Commonly, low level like chlorhexidine can be used, or other compounds like commonly available detols and savlons. They do not harm the skin. Now, another important is cleaning. Then what do you mean by cleaning? Cleaning means when the pathogenic organisms are reduced so that you don't need to wear a protective attire. Have you understood or not? No. Okay. So during the pandemic, you have seen there is something called PPE. Most of the healthcare workers were wearing PPE. So what is the purpose of that PPE? It protects the healthcare worker from the infectious agent. But if we do render the room or the premises in such a way, you don't need to wear the PPE. That is called as clean. Okay, until unless the organism gains direct entry into your body either through a puncture in the skin, direct venous access, or inhalation, you will not get infected. For example, like this room, obviously there are many organisms on the floor, on the walls, they are not infecting you. You can roam here without protective covering in your normal clothes, you will not get infected. So what we do in this room is called as cleaning. However, if you go to the ICU where there are many infectious patients, the organisms are there. For that we need disinfection. Cleaning alone would help. This is the difference. Have you understood? Okay. Now let us move on. Okay. The mathematical correlation for cleaning is at least 1 log reduction. If you can remember, it's very good. If you can't remember, fine. Please do remember the mathematical interpretation in case of sterilization and disinfection. That is very important. So, for agents of cleaning, what do we use for agents of cleaning? We need to wash. It could be clothes, it could be surfaces. What are the commonly used materials? Detergents, soaps, and enzymatic solutions. Okay. Now, if we do compile all this information in one table, this is the table you will see. On the left hand side, you can see what are the levels of activity, whether it's a sterile and disinfectant. On the right hand side, you can see the action of these on various types of organisms. What are the various types of organisms? Most resistant are the bacterial spores, then come the tubercle bacilli, then the enveloped viruses, fungi, vegetative bacteria, and finally enveloped viruses. Now, enveloped virus means the virus will have an envelope. It's a lipid containing envelope. So, any soap solution is sufficient to make the virus non-infectious. If a virus loses its envelope, what will happen? It can get into the cell. And because the envelope is lipid, so if you use even a low level disinfectant, you can neutralize the virus, envelope virus. This is a gist of all. There is one particular another infectious agent known as prion. I have not included in that. Okay. When you will do study about prions, it has got a separate methodology of sterilization. Now coming to the next question. Over here, a 45-year-old male patient undergoes a laparoscopic surgery. Post-operatively, the patient develops an abdominal abscess and the culture reveals the growth of an organism, a bacteria called as Pseudomonas aeruginosa. The investigation reveals that the laparoscope instruments were improperly sterilized due to malfunction in the autoclave. What is this type of infection called? It is called as iatrogenic infections. That means, or more precisely nowadays, we can call it as healthcare associated infections. Now, if we do have to correct this, what we have to do? We have to learn the process of sterilization. Okay. What are the common process of sterilization? Let us look into it. First of all, we need to know what is called as CSSD or Central Storage Supply Department. What is this department? This is the department which cleans, disinfects and sterilize all the things that are required in an operative room. It could be linen, it could be instrument for both routine, elective and emergency surgeries. Every hospital have to have its own department, that is the CSSD. Now, if you look at the structure of the CSSD, you will have three main areas. The first area is known as the decontamination area. Over here, all the used items, it could be instrument, it could be anything, they are received over here. Then it goes into the area called as decontamination area, because all those which have been used are now considered to be as infectious. So first we need to decontaminate them. Furthermore, all the used item will have some sort of organic material on them. It could be blood, it could be tissue. Whenever there is an organic material, the process we use for sterilization or disinfection will be insufficient. So we need to clean them first. That is to get rid of the organic matter. So that is done in this area called as decontamination area. Okay. After the instruments and the clothes, linens are decontaminated, they are packed in this area called as packaging area. Why they are packed? For the next step, that is the most important part, is the sterilizing area. There you can see this is the area that is demarcated, and it is almost separated architecturally from all those areas with only small doors by which the packages can be transferred. And in this area, the sterilization occurs. After those are sterilized, they are packed and kept in a storage area. As and when required, they can be dispatched. The movement of the materials is unidirectional. Unidirectional means it both materials and human movement should be from decontaminated area to packaging area to sterilizing area and then issuing area. Never the other way around. Okay, have you understood? So this is in very short CSSD. So okay, so from this CSSD, every time any procedure has to be done on the patient, either in the ward or even in the surgical room, the instruments are issued from over here. Now let us look at the second most important part, that is the factors which influence a sterilization or a disinfection. What would be the factors? Most importantly will be organism load. The more contamination, you need the more higher quantity or higher concentration of the disinfectant. Second will be what type of organism you are dealing with. I have already told you, most resilient are the bacterial spores, are most easily organism which can be rendered non-infectious are enveloped viruses. So depending on the type of the organism you are dealing with, you have to use the various methods. Then the contact time, temperature, relative humidity, and finally is biofilm. Why contact time is important? Based on the duration. Some sterilizing agent can give you optimum sterilization at a very short period of time. Those can be used on an emergent basis. Some may take a long time. So depending on that, you have to choose. And finally, biofilm. What is a biofilm? I think this you can answer. What is a biofilm? No idea. Have you seen algal growth on water bodies and pipes? A kind of a fluidic material that sticks onto the pipes, right? So in our context, that is also a biofilm, but in our context, microorganisms will have biofilms on any object that is associated with the human body. It could be a central line catheter, it could be a urinary catheter, it could be a intubated tube. So all these are foreign bodies. So whenever these are placed on the human body, the organisms which are colonizers, that is commonly found in the skin and other areas, they will colonize these foreign bodies and form biofilm. Now if the biofilm is present, what will happen to the sterilizing agent or the disinfecting agents? It will take more time to act. So we need to remove those biofilms mechanically before we can go for sterilization. So we do need to check whether biofilms have is present or not. So these are the factors which determine what kind of agent we need to use for sterilization or disinfectant. Now based on that, there is something called as an ideal, although there is no ideal. What could be the ideal activity? It acts on all type of organisms. If possible, there should be one method which acts on all types of organisms. It should be rapidly acting so that the time duration is less. It should not be affected by environmental factors including organic matter. So we don't need to go through all the decontamination, cleaning and all those methodologies. It should be non-toxic because somebody has to do the process. You cannot use a highly toxic chemical. It should be compatible with all surfaces, be it a metal, be it a plastic, be it a linen, because some agents will be corrosive to metals, some agents will be corrosive to plastic materials. So ideal disinfectant should be effective on all types of materials, should have no pungent odor, it should be economical. That means it should not be extremely costly, otherwise you can't use. Again, it should be environmentally friendly. We cannot use a very toxic agent. We are using it, then we cannot waste, dispose it off. Practically speaking, there is no ideal state. That is the reason why we have to choose the type of methods we follow for sterilization based on the need and based on the where we are. A very important classification is called as Spaulding's classification of medical devices. Now, what is this? Why we need to learn this? Because during the service of healthcare, we are dealing with lot of devices which come in contact with human bodies. Some devices are placed in situ, that means within the human body. Some devices come in contact with skin and mucous membrane, and some devices only come in contact very short period of time. Based on that, Spaulding has classified all those devices based on the type, when and where they are used, and the type of sterilization or disinfection we need to use. Now let us look at the devices. He has classified into critical, semi-critical and non-critical. What are the critical? It normally enters a site of the human body that is normally sterile. So what are the sterile parts of the body? That would be the next question. And what are the non-sterile parts of the body? Simply remember, the GI system from mouth to anus is a non-sterile area. The respiratory region above the larynx is non-sterile. Okay. Rest, almost all areas are sterile. The cardiovascular system is sterile, central nervous system is sterile, musculoskeletal system is sterile. So anything that is entering into this system is entering in a sterile area. Now when I say sterile area, that means even an organism with a very low pathogenic potential, if it does enters, it will cause the disease. For example, in the CSF, it's a anatomically aloof area and has no microorganism. So even a commensal bacteria that is present on the skin or mucous membrane of human body, if it gains access into the cerebrospinal fluid, what will happen? It will cause meningitis. So any device which enters into these sterile areas, what has to be the nature of that device? It has to be absolutely devoid of any form of microorganisms, even spores. That means it should be completely sterile. Have you understood? When I have said that, now look back. All the syringes, needles, they are pre-sterilized. Once you open, you have contaminated it. You can't use it again because it is entering in a sterile region. Next comes is the semi-critical. It comes in contact with mucous membranes or body fluid. What are these sort of instruments? Huh? No. Needles enter in sterile areas of the body. Which catheter? No. Urinary catheter enters into the urinary bladder. Urinary bladder is a sterile area. Then endoscope. Which endoscope? Yes, GI endoscope. It could be upper GI endoscopy, lower GI endoscopy. They come in contact with mucous membranes. However, do not consider bronchoscopy in them. Although bronchoscope is a type of endoscope, but it enters into the lower respirator. In the lower respirator, there are no commensal microorganisms. Okay, it is sterile. So suppose if a patient undergoes colonoscopy, the endoscope is entering into the colon. Through the anal canal, rectum, it is coming in contact with mucous membrane. There are many commensal bacteria. Now, what sort of sterilization or disinfection do you need to that? That means your device may not be sterile, but it should have no pathogenic organisms, right? That is the reason why we need disinfection, that is the high level disinfection. Recall the 3 levels of disinfection. So, for those instruments we need high level disinfection. These include respiratory equipment, it could be a intubation tube, a laryngoscope, non-flexible endoscopes, right? So, these are called as semi-critical instruments. Finally, we come to the non-critical. They come in contact with intact skin. No exposure to sterile area, no exposure to mucous membrane. Intact skin. We need low level disinfection. Now, what could be the examples of this? Any idea? No. Very simple, a thermometer. When used under the armpits, not in the mouth. It could be a ECG probe that is used on the skin. It could be the stethoscope. These are non-critical items. So, we can easily clean them with isopropyl alcohol that is commonly available. That is a low level disinfection. Understood? So, by this classification, we need to classify all the equipment that are using on the human body. Based on that, we need to ascertain the level of sterility or disinfection that is used. Okay. Now, let us look at the most important sterilants. The first one is, I think you have read about this. I think your contribution is required now. What is this? This is an autoclave. What is the principle behind it? It's a steam sterilizer. What is steam? Water vapor at 100 degrees centigrade. What are the requirements? How does this act on microorganisms? How does the steam kills? Organisms, when it come in contact with the steam, what happens? The steam gives off the heat into the surface of the organism. Because of this heat, the organism dies. As simple as that. What would be the temperature over here? Will it be 100? No, it is higher. What is the temperature? 121 degrees centigrade. And how do we achieve steam at 121 degrees centigrade? By increasing the pressure. If you don't increase pressure, what will happen? The water will become vapor at 100 degrees centigrade and then it will go off. But if we raise the pressure, what will happen? The temperature of the vapor will increase. And what should be the contact time? It should be at least 15 minutes. So, 15 minutes starts when? Now, what I am asking is, you have started heating water. The water reaches the 100 degrees centigrade, it starts turning into vapor. Then you start increasing the pressure. Temperature starts to rise up. When the pressure reaches about 15 pound, temperature will go on reach up to 121 degrees centigrade. When these two conditions are met, then we need to keep it for 15 minutes at that same temperature and pressure. That is the contact time. Have you understood? So, the whole process is not for 15 minutes, it is much longer depending on the size of the instrument. Contact time is for 15 minutes. Okay. Now, there are many types of autoclave. It could be a vertical autoclave, it could be a horizontal autoclave, it could be a digital autoclave. There are many variations of it, but the main functioning methodology is same. The moist heat destroys the microorganism by denaturing of enzymes and structural proteins like horizontal autoclave or a tabletop autoclave or a vertical autoclave. There are many variations, and this is how it acts. There is a steam jacket, there is a pressure chamber, and there is the electrical heater. The electrical heater heats the steam, the pressure chamber increases the pressure till it reaches 15 pound. When the temperature is 121 degrees centigrade, then it is kept for 15 minutes. Then the septal valve is released, the pressure is let go, the temperature drops down, and when it is conducible to take out the materials, we take out the materials. Okay, that is all about the sterilization. Now, what are they used? Sterilization is a very common methodology that is used for all critical and semi-critical instruments or items used in the hospital. Furthermore, as far as the biomedical waste management is concerned, all laboratory, especially microbiological waste, should be first autoclaved and then disposed according to the biomedical waste guideline. Please remember this. All microbiological waste are infectious, should be rendered non-infectious in the laboratory itself and then only disposed into the biomedical waste according to the guidelines. Okay. Now, why this is very commonly used? Because it's an effective method and it's a very cheap method. We need water and electricity. Problem is that the pressure and steam corrodes many equipments. Plastic equipments get damaged, even metal instruments over time will get damaged and get rusted. So, this is a problem. Now, coming to indicators. Now, why indicators are important? We have put the material in the autoclave, we have done the process. Now, we need to ascertain whether the process was done correctly or not. How can we do that? There are indicators or process control. What are the process controls? The first would be a physical indicator. You have put a probe inside the autoclave which detects the temperature. If the probe tells you the temperature is correct, that's a physical indicator. Similarly, a pressure indicator could be a physical indicator, right? Other would be a chemical indicator. What is a chemical indicator? A particular chemical will change its color when exposed to either pressure, temperature. So, when the chemical indicator changes the color, that means it could tell you that the process was done correctly. And finally, a biological indicator. What is a biological indicator? What is used? We use spores of some particular bacteria. After autoclaving, what should happen? The spore should get killed. Now, when we take that spore and put it on culture media, if it doesn't grow, that means the process of sterilization was appropriate. And if it does grow, that means there is some problem in the procedure with the autoclave. That means there is a failure of sterilization. So, these are the three controls. Try to remember the biological indicator in case of autoclave. This is a very commonly asked question. It is geobacillus stereothermophilus. Okay. Sometimes, now I have already told you the whole process of autoclaving takes a much longer time than 15 minutes. Sometimes a situation might happen. I am giving you an example. Suppose a patient is undergoing a surgery. So, during surgery, many type of instruments are used. For a particular step, say we need to use a particular kind of retractor. The surgeon drops the retractor before using on the floor of the operative room. Now, that instrument is now contaminated, but we need to use that instrument. What will you do? Can we cancel the surgery? So, there is another method, this is called as flash sterilization. This is not recommended, but this is sometime time. What is done? Over here, we expose at 134 degrees centigrade for 3 to 10 minutes. Okay. This is only done in restricted situations, but This is not a recommended method because there is still a risk of contamination. But this is the method. Now coming to the next method, this is called as ETO sterilizer or ethylene oxide sterilizer. Over here, ethylene oxide is used for sterilization. What it does, it damages the nucleic acids of the microorganism. What is the advantage is that how it is done? It has three processes. First is a preconditioning, in which after the package is kept inside the ETO sterilizer, vacuum is created, then ETO gas is pushed into that vacuum, and then extensive aeration to remove ETO. Now ETO is not conducible for human inhalation, so proper usage is very important. Next comes the question, then why it is used? Because this can be used on items which cannot be exposed to high temperature and pressure. Example, heart lung machine components, sutures, catheters, stents, these are made of various types of method from silicone to plastics. If you expose them to high temperature and pressure, obviously it will get deformed. Why? Because in ETO, temperature and pressure is not raised. Hence, sensitive equipments can be used for sterilization. In you have heard about pacemaker? It's an electric equipment. It is placed inside the body, so it should be sterile. But if you put the pacemaker in autoclave, what will happen? The electric component will get damaged. That is an example where ETO is used. Even if you go back and look the packaging of the syringes and the needles that come as pre-packed, look for the method of sterilization. You will find this sort of sterilization. Okay. Okay, that was the advantage. Control is Bacillus atrophius. Next come is plasma sterilization. I have already told you plasma is the four state of matter: solid, liquid, gas and plasma. So what is plasma? It is basically a form we get when we superheat a gas. How it is used over here? Hydrogen peroxide is superheated, and in that state hydrogen peroxide remains in peroxide, oxygen and hydroxyl ion state. So these ions will directly react on microorganisms and kill them. That is the concept of plasma sterilization. Now this is also high heat condition. So use will be more or less same as that. Advantage of that is it takes a lower time, more effective, penetrative power is more, and unlike ethylene oxide, it is not toxic. Okay. Same, the indicator will be same as an autoclave. The last physical method, not the last heated method is hot air oven. There is nothing special about hot air oven. It's like a regular oven that you can find in the home. It achieves a higher temperature, 180 to 200 degrees centigrade, and the materials can be kept in the hot air oven for a 30-minute period or a 1-hour period. During that time, the high heat will denature the proteins within the microorganisms, thereby achieving sterilization. These are used especially for materials which can withstand high heat. I am talking about 180, 200, sometimes 210 degrees centigrade. So you need materials which can withstand high temperature. Commonly, the glasswares are used to sterilize this. Okay. Now coming to the filtration, I have already told you filtration is used mainly for two types. One is liquids and for gas. Now what kind of liquids we need to sterilize? Any idea? Saline. Okay. Normal saline, does it contain something? Okay. Before proceeding, try to understand the fact that although filtration is effective, it is not a foolproof method of sterilization. There are bacterial filters which can filter bacteria, but many other agents can pass through. So, filtration is a targeted method, it is not a foolproof method. Vaccine होते पारे, fluid होता पारे. There are main colloidal suspension, not normal saline. Normal saline does have water and salt. You can easily hit it. Okay. Like fresh frozen plasma. How can we cannot heat it? It will get denatured. So we need to use filtration. So many body filters. Now the filters will be two types. You have seen the depth filters, and another is the membrane filter. Like in dialysis machine, you will find that there is a dialyzed fluid, dialysate fluid which goes into the patient's body and comes back again. So we need to filter that also. So those are commonly done by membrane filter. Okay. Now coming to air, there please try to remember two types of filter are there. One is called as the HEPA filter or HEPA filter, another is the ULPA filter. So what does this filter have? They have a pre-filter which collects the dust and the pollens, then activated carbon, and then the HEPA filter which filter out most of the bacteria and funguses. Now next comes the question, why do we need to filter air in the first place? Two specific requirements. First is, in the last class I have shown you biosafety cabinet, a cabinet that is designed to protect us when we are working with infective organisms. The air flows from the bottom of the cabinet and is sucked into the HEPA filter. If there is any organism which comes out within the cabinet, it will be sucked in by the HEPA filter. So we don't get infected. That is the very first use. Second use will be in areas where the patients are susceptible to infections borne by air. For example, in the patients who have undergone bone marrow transplant therapy, they are severely immune compromised. So we need to place them in areas where even the fungal spores that are commonly present in the environment, if they inhale those spores, they will have fungal infections in the lungs. So we need to filter even the air that they breathe in. So that is the use of an HEPA filter. Okay. Okay. So this is a type of membrane filter. So the fluid is first pushed over here, and then with pressure the fluid moves through all this and then comes out over here. Okay, with pressure. A similar methodology can be seen in the RO water filters that are commonly used in homes. The same method. Now coming to ionizing radiation, what is the feature over here? The radiation is given, it ionizes the cells, hence ionizes all the material including proteins, nucleic acid, etc. But important advantage is that the temperature of the materials are not raised. So it's a cold method of sterilization. So if in examination you are asked about cold method of sterilization, radiation would be a very good example. The second would be non-ionizing method. Problem with ionizing radiation is that the operators who are operating, they are exposed to radiation. Ionizing radiation can be restricted. Similar use will be infrared and ultraviolet radiation. These are non-ionizing radiation. Incineration, I don't think I need to elaborate on that. Incinerator basically means burning all the things that are there. And finally is microwave. What is the microwave? Okay. Anything else? Microwave transfer the energy into the any substance on which the microwave exposes on, raising the kinetic energy of the molecules within the material. So when you expose the microwave to that particle, slowly and steadily the temperature of the material that is placed within the microwave will start to rise. So it is also a method of heat sterilization. It's not a method of cold sterilization. Okay. So these are the methods of sterilization. In the next class, we will discuss about the methods of disinfection. Okay. Now, if we look back at the two questions that were asked initially, the first was spreading of infections due to spore. For that, what we need to do? We need to choose a sporicidal disinfectant to clean the ICU. That would be a high level disinfectant. Okay. And the second question, that was spreading of infection because of the laparoscope that was used. What we need to do? First, we need to understand what type of instrument this is. A laparoscope enters into the abdominal cavity, that's a sterile area. So, is it a critical, semi-critical or non-critical? It's a critical. So, what we need to do? Now, laparoscope is a sophisticated instrument. You cannot put the laparoscope in an autoclave and run the autoclave. Okay, ETO is a very good method, but again, laparoscope has to be reused every time. So, can we use that? Most of the hospitals will not have an ETO sterilizer for that, because instrument is a large instrument, and ETO machine generally caters for small. So, what we need to do? We need to use, we need to a chemical method of sterilization. Okay. So, some of the high level disinfectants, if used in sufficient concentration, will act as chemical sterilant. The chemical is same, only the concentration matters. At a lower concentration, it can be used as a high level disinfectant. At a higher concentration, it could be used as a chemical sterilant. Okay. The whole purpose was to give you an idea of practical utility of all these things, because I think lecture class has already been taken on this topic. Okay, fine. Now, moving on to the next part of discussion is, in the previous class, we had discussed about the laboratory diagnosis, how we proceed. So, an important part of laboratory diagnosis is microscopy. And in the routine use of microscopy, a particular staining technique is very commonly used, and that staining technique is called as Gram staining. Now, let us look at what the stain is, why we do it, and what are the importance. And the Gram staining is named after Hans Christian Gram. At that point, it was a time when many people were dying of a disease which was at that point of time called as disease of consumption. Any idea what the disease is? No. Close. Exactly. So, tuberculosis, before the etiology was known, it was called as disease of consumption, not only in the Western world, but also even in India. Like in Bengal, it is called as Khoy Rog. Khoy, and Hindi it is called Shay. If you look at the national program that runs in the country for tuberculosis, there is a particular called as Nikshay. So, the word Shay in Hindi means deterioration or consumption. So, the treatment methodology is called as Nikshay to prevent that. Okay. At that point of time, many doctors were trying to find out the cause of this disease, and all the people were dying because of some sort of damage that was occurring in the lungs. So, what another person was also working on that, he was named as Paul Ulrich. So, Hans Christian Gram started taking the sections of patients who have died of pneumonia, and he started doing the staining. In this staining, he used a differential stain. Differential means he used two type of stains for staining. So, first what he used was crystal violet, and then he used iodine, and then after decolorization he used safranin. two different color. Crystal violet, safranin is red to pink in color, and obviously as the name suggests, crystal violet is violet to purple in color. By doing that, he observed there are two types of bacteria present. One retained the color of the first stain and the other did not, rather it took up the secondary stain. So one appeared as blue to purple, the other appeared as pink to red. This is the how Gram staining was established. There are many modifications of Gram stain. That is not what you need to learn today. What you do need to learn is, based on that staining, the bacteria were divided into two types. One type of bacteria were called as gram positive, which are all those bacteria which retain the primary stain. The other group was called gram negative, which did not retain the primary stain. So what was found out, that the cell wall structure of these two bacteria were different. When you look back, you will find that gram positive bacteria will have a very thick layer of peptidoglycan outside the cell wall. In the gram negative, they do have the peptidoglycan layer, but it is much thinner as compared to the gram positive. Now, when and where it is used? First of all, because we can identify gram positive or gram negative bacteria, any clinical sample. It could be sputum, it could be pus, any clinical sample, we can directly observe the organisms under microscope with the help of this stain. Furthermore, when we are doing the culture and identification, we can take the organism from the culture plate, and we make a smear and observe them with the help of gram staining. Now, to do the gram staining, what do we need? We need this decal. We need a Bunsen burner, a slide rack, microscope, and the staining stains. What are the stains? You need crystal violet, you need gram iodine, you need a decolorizer. It could be acetone or ethanol, and you need a counter stain, that is safranin over here. And finally, you need to wash it off. These are the things that you need. Now, how to do it? First of all, you need to make a smear. How we make the smear? First, we must take the microscopic slide. Now, please remember, the microscopic slide are always greased when it is manufactured, because the slides are kept adjacent to each other, so that it doesn't stick. There is a layer of grease. So before using the slide, you must pass it over the flame so that the grease disappears. After that, you need to make a smear. How can you make a smear? You will put 1 or 2 drops of normal saline, and from the culture plate, with the help of a loop, just touch the colony once or twice, and then mix with the drop of normal saline that you have placed on the slide to make a smear. This is how you make a smear. Then you let it dry. Do not hit a wet slide, because if you do it, what will happen? The water will evaporate, taking the organism, and you will smell and you will get infected. Let it air dry. When it air dries, then pass it over the flame so that heat fixation occurs. That means the smear gets fixed on the slide. If you do not fix, what will happen? When you will wash, the smear will be washed off. That is how you make the smear. After that, you need to do the staining. For staining, first you have to apply crystal violet, flood the smear area with crystal violet, keep it for about 60 seconds. Then you need to add gram iodine, keep it for 60 seconds. Then drain off the excess stain. Then apply ethyl alcohol or acetone for 15 to 30 seconds, and then wash and apply safranin for about 30 seconds. After application of safranin for 30 seconds, wash off the excess stain, dry the slide and observe it under the microscope, under oil immersion microscope. Okay. What you will observe? Some bacteria will take up and retain the primary stain, which will be gram positive. Some will lose the primary stain and take up the secondary stain. It will be gram negative stain. Now here comes a very important question. What is the role of gram iodine over here? Any idea? Okay, we do understand that crystal violet is the primary stain over here. Decolorized is the acetone or ethyl alcohol. What does iodine does? Any idea? Why we are adding iodine? Okay. Anything else? Okay. Suppose this is a bacteria which is gram positive, right? This is the cell wall and this is the peptidoglycan layer. It is much thicker. Let us look at another bacteria which is gram negative. This is the bacteria, this would be the cell wall in which this is the peptidoglycan layer. First of all, this is thicker, this is thinner. Okay, very alright, fine. Now, how does the bacteria takes up the primary stain? All bacteria will have some sort of pores called porins by which the stain enters into the cell. Then we add gram iodine, it will also enter over here. Gram iodine is sometimes called as a mordant. In some of the books you will find it is written gram iodine acts as a mordant. What is a mordant? Mordant is a fixative. In the textile industry, when the clothes are colored, after they are colored, a mordant is added so that the color fixes with the fabric. So when you wash during routine washing, the color doesn't disappear. But if we do read slightly or try to understand how it exactly occurs, it does not act by mordant. I'll come to it a little bit later. Okay. Now the bacteria will be stained, both the bacteria will be stained with gram positive, right? Then comes the role of alcohol or acetone. Now, what does alcohol or acetone does? It dehydrates the cell, any cell, human cell, bacterial cell, any cell. What happens when dehydration occurs? This peptidoglycan layer will get damaged because of dehydration. Now, gram negative bacteria have a smaller peptidoglycan layer, so it will be damaged lot earlier than a gram positive bacteria. Try to understand this. Because it is thinner, so even a little exposure will damage the peptidoglycan layer. But over here, because it is thicker, it can withstand that time of exposure. Then you are washing with water. What happens during that stage is, because the peptidoglycan layer is damaged, there are cracks over here, water comes inside, and when you wash, this will get washed off. But over here the peptidoglycan is not damaged, the primary stain is not washed off. Now when we add safranin, we will find that this bacterium has taken up the counter stain, but this one has not taken up. Then only we can say this is gram positive and this is gram negative. Have you understood till now? Now you tell me, what will happen if I expose the acetone or alcohol for a prolonged period of time? Exactly. So that is called as over-decolorization. If we expose for a prolonged period of time, even the gram positive bacterial cell wall will get damaged. It will also take up the counter stain. This is called as over-decolorization. What would be the other end of the spectrum? If we expose for a very fraction of second, even the gram negative will not be decolorized. So both will appear as gram positive. So what will happen if you over decolorize? Gram positive will appear as gram negative. What will happen if you under decolorize? Okay. Now answer me. Suppose both he and she have made a smear. She is saying the organism is say gram positive, but he has done the same smear and he says it is gram negative. Who is correct and who is wrong? Time is 15 seconds. He is saying he has put for 15 seconds. She is saying she has put for 15 seconds. Now who will be correct? Is she correct or is he correct? So we need control. Try to understand, everywhere we need control. What can we do? We can take a slide. We will make 3 smear. We will take a gram positive organism. We know that this is gram positive. There is no debate. That's a control, positive control. We take a known gram negative over here and we make a smear in the center, which is the test organism. Then we stain the slide throughout. After staining, if my known gram positive is or purple in color and gram negative is pink or red in color, whatever the color of the my test will be gram positive or gram negative. Have you understood? This is the reason why you need to understand the concept of over-decolorization or under-decolorization. If your staining methodology is wrong and you have over-decolorized, the control gram positive will also appear as gram negative. If you have under-decolorized, your control gram negative will appear as gram positive. If your control is showing properly gram positive and gram negative, that means your staining methodology is correct. Understood? Okay then. Now coming back to the question. What is the role of iodine? In simple terms, in some of the books, it is written it acts as a mordant. If you say that it acts as a mordant, fine. Nobody will argue with you. But if you try to understand how it exactly occurs, I'll tell you. See, the crystal violet has chloride ion in it. Okay. So it's a complex of crystal violet and chloride. This is a two-dimensional structure. Because it's a two-dimensional structure, it can enter through the poring channels in any bacteria, gram positive or gram negative. When we add iodine, what iodine does is it displaces this and forms what is known as crystal violet iodine complex. Now this crystal violet iodine complex is a three-dimensional structure. Now because it's a three-dimensional structure, it cannot now get out through the poring channels. The only way it can go out if the cell wall is damaged. This is where acetone or alcohol comes. With the exposure, acetone or alcohol dehydrates the cell wall, and when something dehydrates, there will form cracks on it. If we can time the decolorization properly, we can damage the peptidoglycan layer of the gram negative wall without damaging the gram positive wall. This is how crystal violet iodine acts. Okay, that was all about the theoretical discussions of gram staining. Now let us look at the uses of gram staining. There are many modifications from gram staining. I am not going into all those. Now why it is important? First of all, it gives us an idea of whether the organism is bacteria is gram positive and gram negative. Why it is important? Because the cell wall structure is different. From the therapeutic point of view, it is also important because the gram positive, there will be some antibiotics acting on gram positives. They will not be effective on gram negative, and some antibiotics which will be effective for gram negative organisms will not be effective for gram positive. So if in any clinical sample, suppose a sputum sample comes and I can see on gram staining there are pustules and there are gram positive bacteria. Even if I can't identify what organism is that, I can at least inform the clinician that you can administer based on this some antibiotics which will be acting on gram positive. That is the practical application of gram staining. Next type of application will be, we can look at the morphology. Morphology means the shape of the organism, whether it's a cocci or bacilli, whether it's gram positive or negative. That is how in your textbook you will see most of the organisms are classified based on gram and morphology. The organisms will be gram positive cocci or gram positive bacilli, gram negative cocci or gram negative bacilli, gram negative coccobacilli or gram variable organism. Okay, this is the basis by which it has been classified. Okay, some of the examples of gram positive organisms I think you have already been taught. Staphylococcus, Streptococcus, Enterococcus, these are common. In gram negative it will be Neisseria species. Then let us look some of the pictures. Over here you can see, what can you see? Don't jump on conclusions. What we can see, these are, what is the shape? Cocci, gram positive cocci. Furthermore, arranged in groups. Probably this is how Staphylococcus looks like. What is this? This is also a cocci. Two cocci very adjacent. Gram positive cocci in pairs. Yes. Okay. What are these? Look very carefully. These are cocci and arranged in chains. So what it will be? Streptococcus. Gram positive cocci in pair or Diplococcus is strep pneumoniae. Okay. What is this? Gram positive cocci, not a regular shape. That means every shape is different, arranged in pairs, tetrads and octads. This is commonly Micrococcus, environmental commensal. What is this? Shape is bacillus, gram positive bacillus. Example is Clostridium. What is this? This is also gram positive bacilli and this is Listeria. What is this? This is also gram positive bacilli, but one more thing. Can you see branching over here? Look at this, like a tree branch. This is gram positive bacilli with branching pattern. This is Actinomyces or nocardia. What is this? Gram negative তো হলো, shape কি? Gram negative cocci. Example would be Neisseria. What is this? Cocci. Gram negative cocci. This is coccobacilli. Some are very small like cocci, some might look like bacilli. Okay, this is called as coccobacilli. What are these? These are gram negative bacilli. This would be common example would be E. coli. What is this? Gram negative bacilli. Anything else? Can you see these are curved? When curving at a particular area, this is curved, gram negative curved bacilli. Vibrio. So these are the predominant ways by which organisms are classified. It could be gram positive cocci in groups or clusters, Staphylococcus, gram positive cocci in pairs, Diplococci, gram positive cocci in chains, Streptococci, gram positive bacilli in branching pattern, gram negative cocci, gram negative coccobacilli, gram-negative bacilli and gram-negative curved bacilli. So all the pathogenic bacteria, pathogenic means pathogenic to human disease or humans, causing human disease, are classified in this way. Okay, what could be the problems if we see erratic results on gram stain? Why? It could be because of antibiotic. Why? Any antibiotic which acts on cell wall will damage the cell wall of the bacteria. So on gram stain it will behave. Will it behave normally or not? Abnormally. A gram positive might appear as gram negative. Similarly, on a laboratory culture, if we are taking fresh culture, what will happen? The bacteria is a dividing phase, cell walls are well made, appearance will be classical. But if the cultures are old, most of the bacteria are dead, the cell wall gets damaged, appearance will be altered. During heat fixation, you have heated a little too much, the bacteria are damaged. It could be because the smear is so thick that whole procedure has gone to haywire. Over or under decolorization can occur if you are making thick smear. Then prolonged decolorization, excessive counter staining, all these can alter the appearance. Okay, that's all for today. Now you have to go to the practical labs, and today you will be performing gram stain. You will be provided with culture plates. You have to make the smear, you have to do the gram staining, and you have to observe it under the microscope. The question is why? Because in your examination you will be given a clinical condition with a case.
তোমার যার হয়ে গেছে ওটা স্মিয়ার করা, সে এবারে হিট ড্রাই করতে শুরু করো। আমাদের এখন এয়ার ড্রাই করার সময় নেই, হিট ড্রাই করো। জাস্ট একটা সাইড ধরো, একটা সাইড ধরো, একটা সাইড ধরো, একটু করে হিট দাও, হ্যাঁ এবার হয়ে যাবে। ঠিক আছে, ছেড়ে দাও, হিট দাও, সরিয়ে দাও, একটু করে হিট দাও, সরিয়ে দাও। আমি ওটা প্রসেস দেখা লাগবে। একই ব্যাকটেরিয়া আছে, হিট করার দরকার নেই, দাও।
যাক, তুমি এবার দেখি বস করো। আরে আমাকে দিস না, আমার এখনো হয়নি এটা।